committee to order. It is, 6:01 on Tuesday, October 10th. So I call this to order. We have a request to emulate the select board and start our meetings with the Pledge of Allegiance. So, Sue, you want to lead us in that?
Oh, sure. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. So the next item is new business, which is the main purpose of our meeting today. We've invited our outside agencies and regional associations and health agencies who are requesting financial support from the town to come in and share their information and help make their case so that we can have more information and make an informed decision. So, come on in. Is the representative, so our first on the list is Voices Against Violence. Do we have a representative for that? Great. Sit up here next to the microphone so we can, anyone who is watching in on the computer can hear what you have to say.
Great. I did bring some brochures that weren't part of our packet. I also brought copies of most of the packet, so I didn't know if you wanted hard copies or not.
Well, if you have them, we'll take them, and many of us like paper and some of us like to be sustainable and avoid paper, but
So I just want to thank you, first of all, for doing this, for actually having a conversation with your nonprofits. I know Voices serves 21 towns in eastern Grafton County, and you're the only ones that allow us to come in and actually answer questions, tell you a little bit more about us. I'm Meg Kennedy Dugan. I'm the executive director at Voices. I've been there for 11 years. And finally, we reversed alphabetical order, so thank you so much. Yay! It's the little things that make you really excited. So anyway, I'll say just a little bit because then I know how precious your time is tonight. We're a crisis center. We just celebrated 40 years of service to our communities that have always included Bristol. Bristol, I believe, is the second highest in number of people that we serve, second only to Plymouth. And we work with survivors of domestic and sexual violence, stalking, human trafficking, bullying, and we work with anyone, adults, children, teens, male, female, no matter how you identify. And we have a confidential shelter that we run. We have a 24-hour hotline, and we always say with that, you don't have to be in crisis to call. There's always somebody there to reach out to. Every time at the hospital there's a sexual assault, they call us, and one of the advocates goes right over so then they can say there's somebody right outside waiting if you want to meet with them. The court calls us whenever there's a restraining order being submitted and somebody would like our support. We work with DCYF anytime there's a co-occurrence of child abuse and neglect and possible domestic violence. We're part of that process. And we also work with a local child advocacy center working with a non-offending parent and children. So we serve a real wide, well, as you can see, we serve over 700 people every year. We do presentations to all the way from elementary school to the college to the senior center to thousands of people every year, just trying to educate them. And even though we do receive federal and county funding, it's never enough to get us through, and so we really rely on towns such as Bristol to help us, and we're very grateful. So that's trying to keep it really short, and then I figured whatever questions you might have.
In your letter, you state that Voices provides 661 services to 43 survivors in the town of Bristol. Can you define services for us and what that means to your organization?
And that's a great question, because we used to have a little chart right below it, some of you might remember from before, and then we thought people were getting bored with the chart, so maybe we need to put the chart back. So that could be assistance going to court, it could be helping them find housing, it could be helping them with a stalking order. Sometimes we'll go to, if they're having meetings with law enforcement and they want a support person. In the schools, it might be going and helping and meeting with a teen or a younger person if they've had concerns or issues, sexual assaults.
Do you ever get contacted directly from the Bristol Police Department?
We get some calls from them. We would love to get a lot more. I say that, and we're very, very short-staffed, but with all of the law enforcement, we'd always like them to reach out. There's something now nationwide called a LAP, which is a lethality assessment protocol, and anytime they go to a domestic violence and they know this is critical, there's a process they go through, and if they can check off so many of these warning signs that there could be extreme violence, they're supposed to call us. And sometimes we get more calls from than others, so it does vary.
Any other questions, comments? So, go ahead, Walter.
A woman came running to my house one day, and she was afraid of being beat up, and I brought her up there to you, and she was well cared for. Thank you.
Oh, well, thank you for doing that, going out of your way for that person.
So my question really has to do with, I guess, how you come up with the request for the $3,300. So I'm seeing that you say that Bristol is about 6% of your work, and your town donations are about $21,000. Your total local revenue is almost $80,000. So is it that you request a lot more, but you don't? There's some towns that don't give, or how do you get to the 3,300?
That's based on our overall costs, not just on the cost from the towns, because we do have some towns that don't fund us at all. So that percentage is just part of the overall cost for services. And so it's the cost for maintaining the 24-hour hotline, the shelter, advocates, all those kinds of things that we have to have ready to go, no matter who it is from which town. But we've hardly gone up in what we've asked the town for a number of years, and we really did try to be fair and say, okay, we're gonna
I see you are asking for a level funding, and I appreciate that. Thank you.
We've asked Plymouth for the most. That doesn't mean that's necessarily what we get, and then we try to take it down so that the towns where maybe we only serve 3 people from their town all year because they're so tiny, we ask, okay, well, $500 or whatever it might be.
Okay. Anyone else have a question or make a
That was
comment?
the question I was thinking of. No.
Okay. Well, thank you very much.
Thank you.
Thank you. Thank you so
Glad
much.
to let you go first this year after all the years going last.
And I'm leaving Voices in a few months. This is my last time before you. So
I feel like I've seen you time and time again.
thank you.
New face next year, I guess.
All right.
Thank you.
Thank
Good
you.
luck.
All right, so next on our list is Tri-County CAP. Do we have a representative from that organization here? We do not. We will move on. Transport Central. I do know we have some representatives, so.
And you will stay up there for the next one.
Yeah.
We'll get to that one soon.
And it's too bad I'm no longer with the Lakes Region Mental Health Association board because mental health is coming up too. But So I'm Bill Bolton from Plymouth, and I'm the Executive Director of Transport Central. And our organization provides anyone who's over 60 or disabled or a veteran or on Medicaid and who does not receive a ride from anyone else. So we're not necessarily last resort, but there's a lot of like repeat customers because they like our volunteer drivers and they take advantage of our good service. So that's basically what we do, is provide rides. And we've done quite a few rides. In fact, we just broke 1.4 million miles of volunteer miles that they put on their cars. And it's kind of like, we've been keeping track of that since our inception in 2013. And we really kind of like ratcheted it up prior to COVID. And it kind of like knocked the wind out of us for a couple of years, but now we're picking it back up again. And the critical need is actually volunteer drivers. We don't pay for people to drive, people to medical appointments. And because of that, volunteers are kind of not forthcoming. But in any event, I think I provided enough information that shows how many numbers we're talking about as far as all of the 19 towns in our district, our catchment area. And primarily we're Grafton County. We have one New Hampton who's an outlier, but as generally it's a service that we provide to Grafton County. And we go from like Lincoln down to Samberton, and but in any event, I think I've provided a rationale of why we have requested what we have. We actually were, keeping the same ask as we did last year. And I'd love to answer any questions you might have.
I just have a quick one. Actually, just how do you get your volunteers? I mean, where do you advertise? Do you advertise? I mean, what do you do?
Oh yeah. No, yeah. Well, no, we have promotions. I mean, we generally try to like have different promotions through the year. We go to different events.
Yeah.
And we
Hand out cards or flyers or anything like that?
We have that as well. Yeah.
And that's an added cost as well. Is it not?
No, it is. And also, our web presence and social media, we tend to like utilize that as well.
Right.
A lot of it's just a friend of a friend of a friend, which is fine with me because I got my sister to drive for Transport Central, and I put her on the board as well. And my wife just retired after 39 years working for the state, and I got her as the driver as well. So it's too bad I've run out of like brothers and sisters, but
Yeah.
we're working on it.
In one of the request letter, it states in FY 2023, we performed 280 trips to Bristol residents.
Yep.
A 63% increase. And is that 63% increase referred to 2022? So
Yeah.
From 2022 to 2023?
Yep.
Okay.
And you can see the primary thing too. I mean, it's all kind of like very dependent upon who in your town is kind of like aging out to the extent that their family is no longer around, and so that number kind of goes up and down. And then the services that we provide, we do dialysis, where we transport to Hitchcock. A lot of cancers, so there's a lot of like miles that are put on. I mean, it looks like we put on 12,884 miles for 280 trips. It sounds like a pretty big, not a discrepancy, but we put a lot of miles on per trip, primarily because there are a lot of like specialties. There are specialists that we have to go to. But in our 19 towns, we'll pick up anybody, and then we can transport them anywhere. So we do take trips to Boston and Hitchcock, a lot of Hitchcock trips. And up north, in fact, that's pretty much it.
Any other questions, comments, queries?
Anyone need a ride?
I thought you were gonna ask, anyone wanna drive?
That's the next question. Once we get you in the car, we can talk your ear off for an hour or so.
Well, another thing I was gonna ask is that you must find it a little bit more challenging with the prices of gas, fuel and stuff like that, getting that a little bit higher.
You just picked at a pretty interesting question because, yeah, I mean, but IRS has gone up as far as like, you know, acceptable rate to stay below, otherwise you got income.
Yeah.
So it's 65.5 cents a mile. And, you know, that kind of adds up. And a lot of people think that that's great. My sister does not, but, you know, so some people like are very, you know, feel it's an adequate, you know, return. But then there is an issue that I'm going to have to like delve into. But if you're a volunteer, IRS passed something in January. If you're a volunteer, you're allowed 14 cents per mile. If you're a volunteer, or if you're working as an employee of a company and you're asked to drive someplace, you can get reimbursed for 65.5 cents a mile. So what IRS succeeded in doing is to pretty much, you know, kind of destroy like a nonprofit who has, you know, riders or drivers rather, we've been paying them 65.5 cents a mile, which is the break-even point. And now they're assuming that we can now pay them 14 cents a mile, which would pretty much decimate any kind of a, you know, volunteer that we have.
Yeah.
And so we are basically calling them 1099 employees. And, you know, as such, they can earn up to $600 before we actually have to like submit, you know, to IRS. So they're 1099s, but basically they have no income. You know, we don't pay them.
Right.
Unless reimbursement for mileage. So it's kind of like a squishy, I don't like what IRS did because it's not just our agency, it's like everyone's kind of scratching their heads on that one. So, but
So if your volunteers earn more than $600 in reimbursement, you have to send them a 1099
Yeah, we have to report.
miscellaneous income, non-employee income, whatever that form is.
yep.
Okay, and then they have to pay taxes. Yep, all right, so if we
that's-
start complaining about the federal government, this meeting's gonna go off the rails, so we'll stop there.
Hey, as long as we don't complain about the state government. We're all set.
Thank you.
All right,
All
thank you.
right, so I think Charlie made a good point. Maybe it would make sense to go out of order because I know that you're with the Lakes organization.
Correct.
The,
They are.
Ross River Local Advisory
Oh,
Committee.
they're actually on, that's, yeah,
On the
I'll
agenda
up the
list.
agenda. Oh, perfect. So if we could, so let's go to the next item on the agenda, which is the PRLAC. and Can't tell you what that
Edmund
is.
Ross River Local Advisory Committee.
Thank you.
Yeah, there you go.
River Local Advisory Committee, perfect.
And I'm basically not senior. Max is the go-to
I'm
person.
senior to everybody here. I only got a couple of copies to pass around.
She got
I go with her, yeah.
Is that mic okay?
Yep.
Okay.
Well, if it's not, Kate will speak up.
Does anyone else need this? Good. Okay, 2 new towns joined PRELAC in 2023, Woodstock and Lincoln. So we've gone from 8 towns that we've been in business with for a long time to 10. They are active. We expect to get them included in the test kit and water testing activity in 2024. We can provide the equipment. We've inherited another kit to do water testing, so we now have 2 in the group instead of running one halfway around the country every other week. So it's made a difference in the amount of driving that we have to do. So 10 river towns now committed to improving and maintaining water quality in the Pemmy. Both North and South teams were out 8 times in this last year, between April and September. And we cover, when we're out, 9 to 10 test sites, and that's between Profile Falls in the south and Woodstock in the north. And probably starting next year, Woodstock will enter the game, and probably Lincoln too. We're looking forward to that. Add to the testing that we do, we also do lab testing 4 times a year. You can see us running around with a lot of little bottles that we fill up, and we're out 3 times a year on that, focusing on areas of the river where there's more likely to be swimming and people in the water. And what we're checking is E. coli, which is a biggie, phosphorus, nitrogen, and chloride at sites that provide swimming, possible swimming activity. The good news, and probably there are people in this group that deserve some credit for that, Mooney Clark River access in Bristol is now owned by New Hampshire Fish and Game. I'm sure you're all aware of that. Users of this access site have complained about roads, trees, runoff conditions at this site for years. So we're looking forward to getting some state help for improving that site in 2024. Prelac was alerted, and this is kind of the way we find out about things that maybe we should know about. Prelac was alerted to construction violations at a Pemmy River site in early 2023. The Shoreland Protection Act, RSA 483B, was totally ignored in the shoreland excavation of this site. Critical tree protection was ignored. No plan had been submitted to DES, a violation. The town of Bristol was not aware of this building activity and had not issued an approval. So approval was eventually provided and corrective action is required. It's now in the hands of the owner, and hopefully we'll keep monitoring whether or not he's meeting his commitment and obligation on the river shoreland under the Shoreland Protection Act. And Christina was involved with that, and let me tell you, she's fun to work with on things like that. Owl's Nest, Campton, Thornton expansion is receiving additional Prelac attention as it developed plans for additional housing. I think a new 9-hole golf course they want to put in, several more wells and water holes. And so most of the water for the expansion will come from the Pemmy. And now towns in that area, Campton and area, are becoming concerned that there will be overuse of river water the way these plans are unfolding. That's yet to be determined, but that's high on the concern list of towns up in that area now, is the expansion that's underway, and there's a lot going on there. The water consumption out of the river, that's where mostly going to have to come, but they're digging water holes. I think they want to put in 10 more wells to support housing and things of that nature. So,
Well, they're also putting a vineyard in.
yeah, and that's coming out of the river too. That's true. So that was kind of my highlight list. So I don't know whether you want to talk about anything else or. elaborate a little more on something that's going on? Bill, what do you think? What did I miss?
I think you hit it.
Are there organizations similar to yours on other rivers in the state?
Yes, about 20,
Oh, about 20 other groups like yours?
yeah.
Okay,
Probably a little less than 20, but yeah.
somewhere in there.
You mentioned that there's, the testing is, you take into account where swimming is happening, and I'm just curious, how many spots in Bristol do you test? And I think the only place I've been swimming in the Pemmy was I went down to, across the river and went down Coolidge Woods Road and jumped in the river from there.
Oh, we probably didn't get that one.
There actually is a little picnic area with a place to go in the water.
Yeah. We've seen people, mostly kids, in the water at Mooney Clark. Blair Bridge used to be, I don't know whether there's much going on there
No.
or not.
I mean, and actually it's kind of shallow too.
I mean, most of our swimming happens in the lake at the two town beaches. I was just curious, so you don't have
There are
specific
3 or
swimming
4
areas on the Pemmy in Bristol?
Yeah, there are 3 or 4 sites that we kind of, this goes back a ways, identified as areas where people may have seen people swimming and decided to, let's do additional testing and get a handle on, particularly E. coli, to get that under control.
Well, there is a place that I actually saw some people, because for the first time, my husband bought a fishing boat, so we're out on the Pemmy, and along the water, there's a what's the big campsite up
Oh,
Davidson's.
Well, is it Davison's? Because that's way up a ways, but Davison, so I guess it would be Davison.
Yeah.
But they swim all off that area. I mean, is that considered a beach area?
It would be and should be.
And quite a lot of people are
We
there.
do not test the water there.
It's,
Okay.
it's near Mooney Clark though, so
Yeah.
if you're testing
And
Mooney
would you
Clark
test the
at
same
all-
area?
yeah.
I think part of the question too is, I mean, the town tests the lake at the beach because we provide the beach and we provide the swimming. If Davidson is a private business and they're encouraging people to swim, would think they would do some testing or be concerned about that for
I
their
mean, there's quite a lot of
customers.
people there, so it wasn't just like 5, it was like quite a lot.
Yeah.
I mean, big
Well,
party.
this was the kind of a year with all the rain,
Yeah,
2 or 3 times a week,
Right.
that the river was never that inviting until probably the last month or so. Now it's too damn cold.
right.
And so the river probably did not have that much activity because it was high for, a month or 2
Yeah.
and really moving. You don't want to get out there and you better make sure what direction you want to go in because it's going to help you go another way. But it wasn't a good swim year on the river.
I noticed one thing. So, did you mention Lakes Region Planning Commission? Because we actually utilize the help from Lakes Region Planning Commission to kind of like organize our meetings, and also they do help us like with documentation and.
And our 10-year plan.
Yeah.
It's another activity of the last year. Why didn't I have it here? That the group has been involved in, and that's updating our 10-year plan for the river.
And they're not cheap.
Right.
Planning.
That's why I wanted to get up to $350. I thought Christina took that away from me.
All right. Any other questions or comments?
The river's a
Walter.
lot more inviting today than it was in the mid-60s.
Yeah. What they used to call the Big Stinky, right?
Yeah. I gotta say, you're setting a low bar, Walter.
Particularly if you had a white house in Bristol.
Yeah.
Yeah.
I used to be good friends with Larry Haney, and it turned their house brown every time.
Free.
All of
It was. And it's a lot better now, thank you.
Yeah, and also thank Lincoln for shutting down the mills.
Yeah, yeah.
I don't think they shut them down by choice. It's federal law that we do nothing to the river so that the downstream users can't use it. So thank you for keeping a watch on it.
Well, thank you for supporting us.
Yes,
Yeah.
thank you for coming, gentlemen.
Thank you.
I think that's it. So next on our list is Camille Baker, Hospice and Home Health. Do we have a representative from that group here? We do not. So next on our list is Passaquoddy Garden Club.
Thank you very much for
Thank you
inviting
for
us.
coming.
And my name is Barbara Carpenter. I'm the current president of the Pasquaney Garden Club. I took Jane White's place, and Shirley York would have been here, except she had a very busy day yesterday,
Okay.
at the age of 89.
Yes, she's amazing.
So I just have a brief overview, and I'm sure that you've heard it before, but the Pasquaney Garden Club is a nonprofit 501(c)(3). We've provided our package, which included annual reports, and our request this year is actually the same as it was the previous year, of $2,760. And this request is only used to purchase plants and supplies for the town of Bristol. Plants are purchased for the bins and barrels and hanging plants in the garden itself, which is the butterfly garden, of course. And we work in conjunction with the downtown decorating committee as well. Garden soil, fertilizer, and replacement liners for the bins and barrels are purchased in addition to the plants. This money is used for these types of activities, and we do not use this money for any promotional materials or for speakers that we invite to our meetings. The funding for membership, fundraising, membership fees and fundraising from our membership's contribution, and we have occasional donations that come with people that are pleased with our work. The proposed budget for this coming year is $1,300 for the barrels, for the plants for the barrels and the garden for Bristol only. $400 for the hanging plants, which we order for the town and the DDC actually maintains. $300 for the plants for the intersection between routes 104 3A in the sidewalk area of the TD Bank as well, in the downtown district. $760 goes to 2 times a year of removing the knotweed from the butterfly garden riverbank area, which imposes itself, of course, into the garden. And we tried it once a year, and it really needs to be cut twice a year. And that's an expense that we kind of took on for the town, and I think it's been successful. We have to use some help for the wood chips and bark mulch, because we are an aging group, but we do what we can do to keep the weeding and the bark mulch in place once we have it. So that's kind of the summary of what we do with the money. We are members that volunteer. We plan, purchase, and plant the items that we purchase. Volunteer hours exceed 1,000 hours, and we accomplish this through work that we have. We work to bring in more people, but it's I think it's all challenging in this community, because this is an aging community and everybody wants the same help. One thing that we neglected to say, and I looked in previous years, we have a list of charitable organizations that I might just review that we raise money by doing the plant sale. That's our major fundraiser. And of that money, we donate to the Newfound Every Child Is Ours, the TTCC Summer Scholarship Program, the Bristol Fire Department, the Boys and Girls Club, and we do, and I already mentioned that we purchase the wreaths for the town at the holiday season. Any questions?
Thank you. I don't so much have a question, I just want to say that I think Bristol generally looks nice, and a lot of it is due to you and your volunteers, so thank you, not only for coming tonight, but thank you for all the work you and your fellow gardeners do for us.
Thank you very much. And we hear it when we're out there watering barrels. And one of your key people in this community years ago, before I even came to this position, just a little anecdote, our plumber, Matt Greenwood. You all know Matt, of course. His family has been in our plumbing life for years. And he came one day, this is before the beautification really got underway, and he said, "Do plants and flowers really make a difference in a town?" And the answer is completely yes. Thank you very much.
Thank you.
Thank you. So, Newfound Lakes Region Association is next on our agenda. Do we? Yes, we do have. Great.
Yeah, two.
Great, come on up.
Do you want the big chair, or you get the big chair?
Oh, boy.
I'm here to support.
Excellent. So thank you for the invitation. My name is Paul Pellissier. I'm the Conservation Program Manager for the Newfound Lake Region Association. Usually Rebecca Hansen, our Executive Director, sits in this chair and asks for money, but she is unable to make it today. She sends her apologies. I want to do a couple things. First, I just want to say thank you for the town of Bristol's continued support in our mission work. The funds that you allocated last year went directly to supporting all of our core programs, whether that's water quality monitoring, invasive species prevention, early detection of invasive species, stormwater management, and education and outreach throughout this community and other communities in the watershed. Wanted to provide some highlights. It's been a pretty interesting year for the water in the watershed in the lake. No doubt you guys have noticed the amount of rainfall we've gotten.
It's hard not to.
It's been extremely wet this year, and not only in terms of total volume, but in terms of intensity of storms. So our stormwater programs are more important now than I think they've ever been, both at the municipal level. We work with watershed towns to execute major projects in our watershed plan. But then this year we also revised and revamped our small-scale stormwater program. So we work directly with area residents in the watershed to identify sources of stormwater pollution on their properties, and then develop ways to address that pollution before it has a chance to get to the surface water and eventually to the lake. Other highlights, in a roundabout way, we had an interesting year for invasive species prevention. Newfound Lake remains the largest lake in New Hampshire free of invasive aquatic plants, and I can say that with some confidence. We work every year to train volunteers in aquatic plant identification and survey techniques. This program has seen a pretty big expansion of late. We now have 29 volunteers that are trained to go out and look for invasive aquatic plants in the environment. And this year we were successful in surveying 100% of the nearshore habitat area for invasive species, which was a big milestone for us. We haven't done it before, and important for two main reasons. A, our lake hosts at Wellington have been busy. There was a saved possible introduction of an invasive Eurasian water milfoil. So that was a big win for us and kind of necessitated all of our volunteers getting out and completing these surveys. And then there's a new aquatic invasive in the neighborhood. Spiny water flea is a small zooplankton now found in Lake Winnipesaukee that we're gonna have to be on the lookout for. Also want to just put a plug in there for our environmental education programs. My counterpart, Mirka Zepatel, is our education outreach manager. She is plugged into this community in terms of engaging with after school programs, getting out there and engaging with all the schools in the watershed and some outside the watershed. She works with Danbury as well to get people to get students and educators better equipped to understand the environment and our role within it. The last thing that I want to mention here is that we are requesting an increase in funding year over year, and that was at the request of a budget committee member. I wasn't here last year, so I don't know who, but thank you for
I don't know
that
who
suggestion.
I don't know who either, but I kind of want to hit them.
So I'll claim ignorance on that. But what I will say is that that increase in funding goes directly to supporting our expanding programs, and that's something that given water quality issues that we're seeing. I do have to say, I missed a note here saying that we are engaging directly with the town of Bristol as a partner on the water quality study group, looking at water quality in the southern end of the lake as well. And our ability to engage as a partner really comes from our volunteer 37 years of volunteer water quality monitoring data. So that's another big service I think we provide not only to this community but to the watershed too. So that increase in funding directly goes to supporting our expanding programs. So thank you for your consideration.
Okay, before I ask for questions, for our records, we want to know everyone's here. Can I ask you to introduce yourself?
And of course, Jim Fitz, I'm the board treasurer.
Thank you.
You're welcome.
Any questions from committee members, or? You were quite persuasive, no questions.
And again, thank you.
We know you do good work, so thank you very much.
Thank you, appreciate it.
And how often is the Wellington launch staffed during the summer?
So we actually expanded our staffing of the Wellington launch this past year. It's now staffed 6 days a week, starting at 6 a.m. There's extended coverage Friday, Saturday, and Sunday from Memorial Day to Labor Day. And this year we surveyed about just over 2,000 boats there, which is down from last year. We had an all-time high over 4,000 boats.
Does your organization provide the training to those lake hosts, or is that provided by New Hampshire DES or something like that?
So it's a partnership with New Hampshire Lakes, which is a statewide nonprofit. So they kind of handle coming up with the training materials. But NLRA works and recruits individual lake hosts and trains them up for our particular boat launch.
So I guess not having anything to do with your funding, but just a question. I noticed when I was on the beach, the Bristol town Avery Crouse beach, after one of the really intense rains, that halfway down the beach there's I think it's the stream that comes across North Main Street. There must be a pipe under Lake Street and through there, and it really cut a pretty good trough through the sand. That to me seemed, this isn't budget stuff, this is just being a nosy neighbor. To me, that's something maybe the town could use some help in figuring out how to make that such. Is that a project already on your list, or is that something that I should talk to Christine about getting it onto your list? Or?
So I know exactly where you're talking about.
Yeah, I thought you might.
And that particular culvert and outlet has been brought to my attention twice, and once recently. And I've been out there during storm events to see kind of how much water is moving through. And it's all stormwater drainage. There might be some natural contribution, but it's pretty small. So I've been talking with Rebecca about what a project in that area to address stormwater drainage might look like. And so that's definitely on my list, and I think it's something that the town and us could definitely work together on.
But I know you did some work with us at Cummings about, protecting that type of thing. So I'm not an expert. I was kind of hoping it was the same type of thing, and we could do something to improve that. So, but it has nothing to do with budget or funding, so I'm not trying to put you on the spot. I don't need a detailed answer.
I think what's maybe different from the work that we did at Cummings is that there's a lot more stakeholders involved, right? There's a lot of properties, a lot of impervious surfaces owned by different groups. So a project would have to kind of rally around all of those groups. An interesting thing, though, is that there's, within the DOT right-of-way and the church parking lot area, there is some unused paved areas that could be reclaimed to facilitate infiltration. So I think this is one of those projects where there is a possible solution on the table. It's just a matter of working with everyone to get it done. And so definitely high up on my list.
Okay,
Yep.
thank you. Anyone else want to bring anything up before we let these guys go? No? Thank you for coming, we appreciate your time.
Yep.
So we're running a little bit ahead of schedule. Before we move on, let me just go back to the two groups that were scheduled for the 6 to 7 o'clock, who we haven't heard from yet. Is there anyone here from Tri-County CAP or from Pemmy Baker Hospice and Home Health? There is not. So I think we should move on. It's a little bit early, so we'll just see who's here and let them go, and we'll eventually go around. So next on our list is Lakes Region Visiting Nurse. Do we have anyone from that group here? Not yet. Lakes Region Mental Health? You're next then. You get out of here earlier.
Oh my gosh, isn't that good? I knew you guys were efficient, so I came early. No, I'm just kidding. I'm always afraid I'm going to get lost, so I come early. I don't see as well in the dark as I used to. All right, so I'm Maggie. I'm the executive director at the Mental Health Center. I'm here again, like every year. Usually I have Kim Bruno or somebody from town sitting with me, but Kim had book club tonight, so that took precedent over you guys. But anyhow, we're here to ask for support for funding for our access to care, which is how people come in the door. It is what I like to affectionately call an unfunded mandate by the state. You obviously have to have staff manning the phones to get people through the door and get the information and get them into an appointment. And that's the support that we seek. Since last year, we've now been up and running with the mobile crisis team that I told you about, which is a mobile service that the state funds, actually, for us to go to people's homes so that they don't have to go to the emergency room when they're in a psychiatric crisis. I will say it's still in the testing phase. I don't think people are very comfortable with it necessarily. We have a van that I ordered almost 2 years ago. It'll be 2 years ago in February, but perhaps that chip thing and COVID happened and somehow I didn't get my van yet. But it's coming from South Carolina and I should have it by December. So right now our staff go out in their cars with 2 people at all times. Sometimes we accompany the police there. But that service has been running now for just over a year and it's been good. I just think that people are much more comfortable going to an emergency room when they're in crisis than they are having you come to their home, right? So it's going to take a while for people to say, yeah, that's how I'd rather be served, but I'm hopeful that that will happen. Other than that, you can see that we served about 89 people in the town and that we gave them about $16,000 worth of charity care. Most of them were adults, 18 were kids, 10 were older people, which means 62 and older, which I fit into the crowd now. I'm so happy to say that. So I can get that discount at Dunkin' Donuts and not feel guilty. But, I don't know. I think you know what we do. We're an outpatient clinic. We do mental health from soup to nuts. If you have a very significant illness like schizophrenia or a bipolar disorder or severe depression, we'll treat you. We also treat people who are just in crisis during an adjustment period. They had a sudden loss, they had a divorce that was messy, what have you. We do it all for everyone. Our offices are in Plymouth and in Laconia. And we see almost 4,000 people in any given year still. And as of today, there are no lines and no waiting. I'm gonna knock on wood, but there's no waiting list. And so we do have enough staff to serve the people who are coming in the door, which is a good thing because as you know, the workforce is an issue. I still have about 20 open positions, maybe 24 out of 200. So, but we're plugging away at it and I'm hoping that young people are inspired to do this work someday. So we'll see. Do you guys have any questions of me about?
Go ahead, Buzz.
The 86 residents served.
Yep.
But that is 86 residents. It's not like 50 residents and someone you saw 3 times. Or...
No, that's
So it's-
unduplicated people,
Okay,
yes.
do you see people more than once during the course of the years?
Oh, yeah. Oh, yeah. Most of the people that we see, I would say that we specialize in long-term services because the illnesses that we treat, although they get better, they don't completely recover. So even if you need a lot of service right now, you might still need your medicine and to see the nurse or something to keep going. But yeah, those are unduplicated people that we see. And I would say people who come in for short-term counseling, they had an adjustment disorder, a bad time in their life, they're gonna get better pretty quick. We usually see them between 2 and 6 times. Sometimes it just takes that once of seeing someone and someone saying to you, you don't really wanna do that, do you? Or you really wanted to get back on your feet or whatever, so. The short-term people are 2 to 6 visits. Most of the people we see them at least once a week, every week for the entire year.
So I guess my question, I know you mentioned you have an office in Plymouth, but I think of you being headquartered in Laconia. And from reading the paper, I know you got a grant and tried to set up a winter schedule. And
Oh,
no
it was
one
a
really
good paper
used
article.
it, and there's so much of that. And then, again, I don't really know Laconia super well, but I know that I thought I had read that they had to disband an encampment area, and then you guys ended up giving them money to do the cleanup after the people left. And so it sounds like you're also really got a lot of focus on trying to solve homelessness. I just want to ask how that's not quite when I think about mental health.
Me
So
neither.
Okay.
I might have a tattoo on my forehead that says yes. Yes to anything. About probably 4 years ago, the state called me and said, would you run a homeless shelter for COVID people? I said, well, I don't really do homeless, and I never ran a shelter before in my life, but okay, you need me to do this, I will. Oh, we'll get you the state school property because nobody was using it at the time, and you can do this. So I did that. Then we got through that, get another call. Maggie, could you do a warming shelter or do something in the cold, a cold weather shelter for people who are homeless? All right, I guess I could do that. Well, can I use the state school again? Yes. So last year we did this cold weather shelter. Hardly anybody came. I'm going to say a dozen people came, maybe a little more than a dozen. And I've got 2 people on duty waiting for people to come. I got a van driver going to take you up to the shelter. So we had money left over from the state, and the state doesn't like to give back money to the feds, which I don't blame them. So they said, Maggie, is there any way you can help homeless some other way with what you have left? So I said, maybe we have a huge encampment problem in Laconia, right? Maybe there's something I can do there. So there I go through the woods with the city manager and walking around trying to figure out how can we clean up this mess, because it really was a mess. People are living in the woods, right? And so they're going to the bathroom in the woods. They're taking care of themselves in the woods. And so we applied some of the funds to that, as well as to Tri-County CAP, and not Tri-County CAP, Belknap Merrimack County CAP, to help homeless with carts and tents and wagons and light up gear so they don't get hit at night, bug spray, practical things, hand warmers, that kind of stuff, so that we could spend down the money. So this year they came back, said, Maggie, would you please do a cold weather shelter again? And I said, no, I don't like to have a party where no one comes. I'm just not really into that's a lot of work. So I said, how about if I do a warming shelter? So this year we're gonna try to have, we happen to own a property on McGrath Street. We're gonna try to have a warming shelter so that when Isaiah's Cafe that has beds, or the Salvation Army that has beds, are closed, because they are closed certain hours, you can come get warmed up, have something to eat, watch TV. I'll have staff talking to you to try to get you into a house or an apartment if that's what you're wanting to do. But at least you can get warm and not freeze to death, and I don't have the fire department calling me that somebody has frostbite. So we'll try it that way this year. So yeah, no, mental health is not really homeless. It's probably the executive director's fault. Although we do have a number of patients who end up homeless because they were unable to care for themselves. They didn't take care of the apartment. We couldn't give them enough support to maintain it. And so we just approached the city of Laconia with community developers to do a project. And I thought that was going to be the newspaper article that you read, because that didn't go well for me. Matter of fact, my watch went red before I talked to the city council because it said your heart rate is up over 120. And I thought, oh my God, help us, why? But it was a bad meeting and they did not make a decision on the project. We're going back again in November.
I think I just was catching up on newspapers. I read that the planning board punted for another month.
Yeah,
or so.
for another month. But we did get a $2.5 million grant for 5 years to do outreach to homeless people who are mentally ill and have a substance abuse issue. So we have a full-time staff member who just started last week, who goes out into the woods everywhere. She's a workhorse. She's great. And she's very nice to people and very respectful, so she connects easily. We have a half-time nurse that's starting next week, I think, who will be seeing those people. They're not necessarily our patients. Some of them should be, obviously, and we will make them our patients if they're willing. But that's going to be a new adventure for us as well. So, yeah. That's the mental health center.
So you have grants
I do.
that will be paying for that. And I noticed from last year on, there was a $4,000 increase. How do you distinguish with what's, the grant, the amount of money that you get for grants and sheltering?
So you're not allowed to use grant dollars for anything that you seek other funding for, because you'd be double dipping. Right. So we make sure that we write the grants for things that aren't funded, and that we ask the towns for things that aren't funded, right? So, because we don't want to mix that, right? So if it's charity care, we're not getting money for the grant for the charity care that we're giving people, and they're not residents of Bristol necessarily. I don't know where they're residents of, because they're homeless. They could have come from anywhere. Matter of fact, they could have come from Bristol and landed in Laconia. But so we always make sure that the grant dollars are very separate from any other request that we make.
Any other comments? I didn't get back to you. I just wanted to make sure you are aware. We actually had quite a bit of discussion about your request last year. So you had 2 years ago asked for $3,000, and then last year you increased that to $7,000. And then we asked you at this meeting last year, where did that come from and what it meant, and you wrote back an email to me and said it comes from, and we need the money, but if you can't give it, we're happy for whatever you can. And I came back to the board, and the select board had told us that they would like to level fund you. But then this committee voted to give you the whole $7,000 you asked for, so that's how you ended up getting what you asked for last year.
Thank you.
So I don't know what the board is, I don't know what the select board is gonna do, and I don't know what we're gonna do.
Okay.
We could go back, we could stay, whatever, but appreciate your responding to the questions we had last year and sending an email, and I don't think I ever sent you a response. I wanted to
You
just
didn't,
speak
but
up
I
and
did
let you know.
remember sending it. I was glad I remembered to email you too, so.
So,
All
did you have something, Christine? Okay, sorry.
All right.
So, I think that was great. Thank you for your time, and
All right.
thank you for coming. Did you have a handout you wanted to give
I'm
us?
just giving them to Christine for the town office.
Oh, okay, good.
That's good. So I worked for Genesis before I came here for 3 years.
Thank you for working with us.
Yes.
Thank you.
Come on in, everybody.
No, it's fine, but I needed.
Oh, it's okay. No, sit over here. That's fine.
Close friends coming.
Oh, okay. Oh my goodness, it's like a.
Sit wherever she tells you to sit.
So it is now 7 o'clock. We are a little bit ahead of schedule, so I'm gonna go back to the top of the list for the 7 o'clock people. Lakes Region Visiting Nurse Association, do we have? If you would sit up next to the microphone so anyone who's watching or want to watch later can hear what you're saying, we appreciate that.
Sure.
So if you could introduce yourself and then tell us anything you think we should know in order to know what's going on.
Sure, certainly. So my name is McGregor Morgan. Thanks for having me here. I'm new to Lakes Region. I've been with the organization now for 2 months, so I'm happy to be here as I learn my way around the different towns.
Welcome to the Lakes region.
Thank you. So just I have a prepared statement I'll make. Dear Selectmen, I am writing on behalf of Lakes Region, VNA, formerly known as the Newfound Area Nursing Association, to formally request a town appropriation of $33,400 for the upcoming 2024 calendar year. Lakes Region Visitor Nursing Association has made significant strides in bolstering our workforce, particularly in the key areas such as intake, staff, who are now available 7 days a week. We have also expanded our team to include a staff speech therapist and a full-time chaplain dedicated to provide spiritual care and bereavement support. Furthermore, we've welcomed 2 nurse practitioners to enhance the quality of hospice care provided to our clients. Our service area encompasses a wide range of towns, including Andover, Alexandria, Alton, Ashland. I think we're up to about 30 or so plus towns. Your generous contribution will play a crucial role in helping us offset the ongoing reduction in federal Medicare program reimbursement rates, as well as supporting the provisions of unreimbursed care to Bristol residents, including those who rely on free care clinics or lack insurance coverage. Over the last year, we have conducted a total of 2,657 in-home visits, benefiting 187 Bristol residents. Among these residents are 175 provided to Medicaid clients, 65 were extended free of charge, 6 patients had no insurance. Our home care services included 2,307 skilled nursing visits, 893 licensed nursing assistant visits, 415 physical therapy visits, 602 occupational therapy visits, 347 speech therapy visits, 24 medical social worker visits, and 26 visits to our chaplain, from our chaplain. In the realm of hospice care, we've conducted 74 skilled nursing visits, 36 aid visits, 19 medical social worker visits, 21 visits to our chaplain, 8 visits by volunteers, 18 counseling sessions, and a physician visit. We've also started our flu clinics in the area. Lakes Region, VNA remains steadfast in our commitment to delivering high quality home care and hospice service to our clients, regardless of their ability to pay. We deeply appreciate your consideration for this request and trust you to place us to help provide the finest care to your residents. Also have some financial docs that shows our year to year.
Okay, great.
And open to any questions that anyone may have.
Do you want to start, Walter, or you want me to go?
Do you feel as though your services have improved that much in the last year?
Absolutely. So since I've been here, we are rated top 2 agency in the state, 5-star by patients. There's only 2 agencies that have received that 5-star rating. The quality is bar none, by far the best I've seen in home care. So we've actually done a lot to focus on quality, regardless of patients' ability to pay or not.
I was asked to be a little bit quiet tonight. In the past, I've been a little bit unpleased with Lakes Region visiting nurse from what I've seen. And I can tell you the number of times that one couple have been told, we don't have anybody available this weekend, call the fire department, go to the hospital.
How recently was that?
Within the last 6 months.
I've been here for 2 months. I know that hasn't happened since I've been here, and I know that won't happen while I'm here. So sorry for the past experiences, but you know, the agency has been without a CEO for the last 8 months, and I've undergone an extensive search to be here now. So in the last 2 months, we've made significant changes and continue to make significant changes. I'll leave my card. Feel free to reach out to me personally if there ever is an issue. I'll certainly be addressing.
I wrote a letter to you people last year and got no reply. The only reply I got was the people that I referenced were tormented by Lakes Region, turned into the state for elder abuse by Lakes Region.
So,
I know the need for the nursing care. I've received wonderful help from Nana, and Lakes Region isn't Nana.
Yeah, so we've done a lot to improve on the care that we provide to all the communities. I've not heard those comments or complaints before, so I'm here now, so feel free to address any of those.
I want to be fair to you, so I know you're new. I want to take a minute just to kind of give you a little bit of background. So, in the past, Nana was a Bristol institution, and I've only lived in the town for 9 years, but I've been told that it was treasured, and if I tried to cut funding, they disemboweled. So now Nana is merged into Lakes Region. And
Right.
we sent out our whole packet last year, and when we had this meeting, no one from Lake Region came. And you asked for the $33,000, and we said, well, and the other thing that happened that confused us a little bit is that for the first time last year, we also got a funding request from Pemmy Baker. So the executive director from Pemmy Baker came and she said, the industry is changing. It's no longer one organization owns a town. Anyone can provide services anywhere. We're headquartered in Plymouth, but we have customers in Bristol, and that's why we're putting in a funding request. So as chair, I said I would take the responsibility, and I reached out to your organization, and I said, hey, we really need you guys to come and talk to us. We don't really understand. We want to make an informed decision. And your predecessor, the previous executive director, and I'm horrible with names, so I can't tell you his name, but you know it. And a woman who I believe is your your nursing director. And he proceeded to tell us all the wonderful things about Lakes Region visiting, for my opinion, he told us all the wonderful things about Lakes Region Visiting Nurse Association and how the organization was so well run and had tons of money and could afford to hire people and was paying great salaries, was in a great shape, and he's happy whatever we gave us, but he didn't really need anything. Kind of, in my opinion, arrogant. So
That's not why I'm here.
So since then, actually, a few weeks ago, I was talking to one of your board members who is a Bristol resident. You probably know who I'm referring to, and she was telling me she thought what a great job the organization does, and the town should fund this. So we're really kind of struggling. Walter originally was talking about how great Nana was, and we should support it, and then he brought up, I have this issue, and we said, well, it's not really a committee issue. And the head of the nursing said, well, write us a note and we will respond. Write us a note as a private citizen and they will respond. And since then, Walter has come back and said, I never got a response, but the people I was trying to advocate for feel like they're getting abused. And I'm really much less happy with Lakes Region Visiting Nurse Association than I was. So part of what we're struggled with last year, we voted to reduce the request that was made. So we said we last year what we said was the amount that we would donate towards visiting nurse, we didn't really want to increase. So if we were going to give some money to Pemmy Baker, we needed to take it out of Lakes Region because we didn't really want to increase the funding. So we ended up where we did last year. And that's also why we sent out a slightly different letter inviting requests, asking for more detailed information, because we wanted to make sure we had the information we need to make informed, correct decisions. So I'm rambling, so I'm going to stop.
No, that makes perfect sense. And I could just talk a little bit more about what's happening in the industry. So we do provide a lot of free care, or we supplement a lot of care we provide. If anyone has Medicaid or a Medicare Advantage program or free care per se, we still provide that same level of care to all those patients. That is, largely due to the funding that we do receive, donations that we receive, and the funding that we do receive from the state or towns that we work with. So we're only able to do that high quality care continuously across the board because of that. If that funding goes away, then our ability to do that goes away, and we start having more instances that Walter was speaking of, unfortunately. So that is the direction we're heading. We're either able to be supplemented and provide care to everyone at the same level. We take the supplement away and we have to cut staff, cut nurses, which cuts into the community even further. And now we have this spiraling down where we have agencies closing. We had an agency that closed last month in the southern part of the state. There's other agencies now with the new Medicare cuts that are coming up next year. We're looking at how we're going to survive because they're going deeper. There's about $4 billion in funding they're looking to claw back from agencies. So right now we are in need in order to continue to provide. We can say we're not going to take Medicaid patients anymore, and that would cut a lot of your residents that are low income or unable to pay. Our goal is to continue to provide the same high level of care to everyone, so we don't have to look at their payments and say we can no longer take this patient. There are other agencies in the state that have stopped taking Medicare Advantage because of the reimbursement and how low it is. We haven't done that. We continue to take all patients regardless of what insurance they have and their ability to pay.
Okay. So the other thing that came up tonight, then, it was Charlie, and he had to leave, so I'll just bring it up. He did a little research, and the other question that we brought up is we said, well, so I'll put it this way, I'm blessed. I don't need, well, I'm not 65 yet, so I don't have Medicare, but next year. We talked about the fact, at least to me, I think about when you go to do a visiting nurse and you're charging insurance, I'm hoping the insurance is going to pay for that. So we talked about the fact that before the merger, before the COVID pandemic, Nana was providing other services. So they would go to the senior group over there and they would do a foot care clinic, or they would do blood pressure screening, and they do things like that. So we brought up the fact that that's not happening. We didn't know if it was because of the merger. We didn't know if because it was all stopped due to the, due to the pandemic and just hadn't restarted. And the response we got from the woman, the nursing manager, said was, well, I'm not aware of that. If there's a community need, we would be interested in filling that, and we would maybe look at that.
Absolutely.
To our knowledge, then that has not restarted.
It has restarted, I can say.
So I was going to say, people from our senior citizen group is here, so I think we're going to, did you want to say
And
something?
part of my little statement is complimenting your agency.
All right, well, good, that's what we wanted to know about.
Yeah. And actually, the blood pressure clinic never quit. It's Eleanor,
Yes.
who we all know and love, and she still comes, but we've supplemented with physical therapy, coming in and doing chair yoga, and you'll hear all about it in just a minute.
Okay.
So one of the first things I did is look at the community piece that we're giving back, because it's so important to us. So a lot of things were on pause because of COVID, and some of those things were, how do we get back the staff? And so what we're dedicating is making sure that each staff member is dedicating time to give back to the community. So we have a primary person and a backup person to provide those services. We actually do have a calendar of all those services. It's on my phone. We're going to put it on our website. We're going to have it community facing so they are aware of what those services are. You'll also see some marketing campaign to really speak to all those services that we're doing and giving back. So between our speech, PT, OT, nursing, you'll see a lot more of this community education that will be happening and restarting if you haven't seen it already. But thank you for being here.
Do you have when you said she has a list, do you have a list that you were going to present to us that what you
I did not know that would be asked for, so I did not.
That's why we asked you to
That's
come
why
so
we
we can
asked.
talk to you.
Absolutely, yeah. So it's something I can provide.
Yeah.
I just have to go back to the office, but I can provide that
Yeah, we
list.
like that.
It's a monthly calendar. It's on my phone because I have the calendar, but I can kind of rattle off those things, those days that we're doing. It's set up just on an ongoing basis, and we have.
Are you asking him to send you the
I'm
list so you
asking
can
him.
take a look? So you don't need to pull your phone out now, but if you just email it to us.
Sure.
The last thing, I just wanted to make a comment, and this is really just a suggestion. I was walking down the sidewalk past your building here in Bristol, the old Manor building, and I saw a sign out front that said flu clinic today with an arrow pointing in. And I thought, gee, that's great, but if I hadn't been walking by, I wouldn't have known about it. So I just wanted to say, we have things, we have a an every other week email that goes out called the Bristol Buzz. We have in one of the weekly newspapers, we have, basically they run a column of what's going on in towns. So there's a correspondent for each of the towns, so you can write to the person for Bristol and get some things in. I just wanted, this is just my own suggestion.
Absolutely.
When you're doing those things, if you could do a little better publicity, I think you'd get more response.
That's great. Thanks for that feedback. And, you know, we just got a call for, I think, 75 employees at another facility that we're going to go and provide that. We were out yesterday doing, I think we have 80 coming up this week as well. The publicity piece, again, we're going to go back to the calendar. We are doing some revamping of our website to make sure that stuff is all out there. That's good to know. We are hiring someone to do our marketing for us to help us push the stuff to all the other towns. I think right now there's some concentration in the Meredith, Laconia area per se, but our goal is to get out to all the surrounding towns. My job also is to get out to all the surrounding towns to do a handshake and a meet and greet and find out how we can better support the communities and the towns out there.
Okay. Walter, go ahead.
There's one woman in your agency now that deserves to be commended. She does meet with 2 people that I know regularly, and they really appreciate the social care that she gives them.
Okay.
I'm ashamed of myself, I've forgotten her name. I could get it, I could call my wife and find out.
I appreciate the good and the bad, so if you do, I'd appreciate knowing that.
You want her name?
Yeah, that'd be great. We do a lot to recognize staff that does go above and beyond and provide that excellent care, so that's good to know.
I guess the thing that I'm trying to say is you have, so I didn't mean to cut you off, but by absorbing Nana, I think of you having a lot of history and resources in this town. But if it gets to a point where you need help or support other than dollars, please don't hesitate to reach out from us. If, you know, we can give you those list of ways to get some more publicity or some things, or to get some more messages out to residents of the town.
That's great to know, and I think it's just a matter of 8 months without having someone at the helm per se. Me being here new, I was at the Bristol office. I come down probably twice a month. I pop in, have lunch with the staff, and kind of figure out what's going on. So I'll make a effort to stop in. I'm still doing my kind of world tour with all the towns and all the other organizations that are out there. So I will eventually, hopefully before the snow gets here, get to RB1. But yeah, it's we are aware of some of those things, and we are working and have made some changes to improve. So I definitely appreciate the feedback.
All right.
I just would note that I walked by the day of the flu clinic and the arrow was pointing across the street.
Well, it was interesting because if you walked north on Lake Street, it pointed into the building. If you walked south, it pointed the opposite. So the arrows didn't both point to the building. One side pointed towards the road, but I still knew it was there.
So there's some opportunities that we'll certainly work on. I appreciate that.
Okay. Anyone else have a question or?
So how would you get that information to us about what are the extra things that you'll be doing? You
Sure.
can email that to us?
I can.
He's got,
Send it to me.
you can
Okay,
send
Christina.
it directly to Christina, or you can send it to,
Town
Do you have a card?
admin.
Yeah.
I don't have
Okay.
it down here. Town admin at Bristol
Bob,
NH.gov.
can you give me the name of that woman that comes and visits with John and Dory?
BristolNH.gov?
Yes.
Okay.
Thank you.
And I'm sure we have your email in a system somewhere.
Yes.
Yeah, I think you were communicating
Yeah.
with Wendy, but if you send it
Okay.
directly to me, that would be great.
Okay, sounds good.
Okay, thank you.
You're also welcome to join us at the senior center on Tuesday.
I will be making my stops in, so.
before I let you go, let's see if Walter's got a name for you.
That's Barbara.
Oh,
And she is to be commended.
oh, nice.
There's 2 former people that were very unhappy that are very pleased with her.
Oh, good. And we do take any complaints and issues seriously. So as they do happen, please let us know. That's something I will go out personally
I
and.
fully intend to, because what I saw before was abuse. It was abuse.
No problem. Yeah, I can definitely address it. I have
And
very
was
broad
very
shoulders, so.
infuriated, and I'm not the only one. The Bristol Fire Department saw the abuse. And there were many people that came here that night ready to speak, and I had all I could do to stop them when I saw how bad it was going. but I can assure you I'll do nothing to stop them the next time the abuse happens.
Not a problem. That was a year ago, so hopefully things have improved and we're moving in the right direction.
And welcome.
Thank you very
Thank you
much.
so much.
And again, welcome to the Lakes region.
Thank you. Thank you. You guys want to speak on behalf of?
So they're up next, actually. My next, according to the agenda, is Grafton County Senior Council, Senior Citizen Council.
Good timing. Yeah. Hi, everyone.
Hi there. Welcome back.
Nice to see you all again.
Yeah.
So I'm Kathleen Vasconcelos. I'm the executive director, and we'll do introductions to start. Allison Morgan, if you all could just raise your hand as I call your name. Allison Morgan works in the administrative office with me. She's our director of marketing and development. And then our local team, Gail Emmons-Shaw, our coordinator here, Fran Olson, our outreach worker, and two of our amazing volunteers. We have 13 volunteers here in Bristol, and two of them here today, Nancy and Aletha, and they are members of our advisory council here locally. So thank you all for being here. So I'll talk about the kind of organization, big picture, and then I'll hand it off to Gail to come on up and talk about the local aspect. So thank you for the opportunity to speak with you tonight about our requests. We are requesting $10,000 from the town of Bristol to support services offered by Grafton County Senior Citizens Council during fiscal year 2024. Our agency was formed in 1972, so for more than 50 years, we've been providing these services. We operate currently out of 10 locations around Grafton County. We have our administrative office in Lebanon, a service link office in Littleton and Lebanon, and we have 8 senior centers, one of which, of course, is right here in Bristol. The others are Plymouth, Linwood, Littleton, Orford, Lebanon, Canaan, and Haverhill. Our purpose is to develop, strengthen, and provide programs and services that support the health, dignity, and independence of older adults and adults with disabilities living in our communities. We offer services such as home-delivered meals, you probably know them as Meals on Wheels, congregate meals, which are provided in the senior center in a community dining setting, and transportation to medical appointments, errands such as shopping, activities, and assistance from our outreach worker, Fred. So during fiscal year 2023, 300 older adults in this community received services from our agency, and that's 37% of Bristol residents age 60 and older. In addition, 89 Bristol residents were assisted by our Service Link office, and our cost to provide services just for Bristol residents was $179,930. So our request for $10,000 represents 6% of that cost. We have increased our request by $1,500. So last year and for 10 years, it has been $8,500. We served 75 more people last year than the previous year, more than 1,600 more meals, 400 more activities, and our cost has increased by tens of thousands of dollars. So we also know that the need is steadily increasing and has been for many years. So as I said, this is our first request for an increase in funding in 10 years. And the 10 years ago when we increased it was only by $500. So it went from $8,000 to $8,500, and it's been at $8,500 for 10 years. So as I'm sure you all know, New Hampshire has the second largest proportion of older adults compared to all other states in our country, and we are the fastest aging state. The need for our services is only going to increase in the coming years, and your support is essential to our ability to continue to do the important work that we do. So thank you. I will hand it off to Gail, and then we'll both be available for questions, if that works for you, okay?
Sure.
So, Gail.
That works for me. So I brought, here's one for you, a newsletter from our senior center here in town.
Great.
You're welcome to have. And so my name is Gail Shaw, as Kathleen said, and I am the program coordinator at Newfound Areas Senior Center, which is right up the hill on Church Street. Oops. So as always, we all want to thank you for considering our request, and it's always a pleasure to be here. We came in smaller numbers this time. So you'll find our menu, local happenings, activities, as well as news from our administrative office in the newsletters. And we create that once a month. I also work in the Plymouth Senior Center as the director there. And so we work sort of as sister centers within the 8. And it's a nice arrangement. Besides our home delivered meal and handicap bus transportation programs, we also offer yummy congregate meals, which of course you're all welcome to join us. It's at Tuesday at noon. We do, and this is where I wanted to mention about Lakes Region Visiting Nurse. So we try to partner with various entities throughout the community. And recently we've partnered with Lakes Region Visiting Nurse, as we always have with Nana. And they offer us a weekly chair yoga at 9:30 on Tuesday before our luncheon with Bobby, who's a physical therapist. The nurses also support us with seasonal flu shots. We just had our flu clinic. We're looking forward to one in Plymouth tomorrow from Pemmy Baker. So we try to keep it local. We have monthly blood pressure and fall prevention checks. So kind of like a matter of balance class. Also by Lakes Region Visiting Nurses. We have crafts and bingo, and we have other games, occasional speakers and musicians as well. I think I've covered most everything, right? We also partner with Hannaford, both in Plymouth and in Bristol, and our generous weekly Hannaford Bristol food donation is distributed to our participants for free before we serve our luncheon, and we always make sure to take time while we're together at the luncheon to share our ideas, our concerns, our plans, and our love every Tuesday. And I know that sounds corny, but it's really, really true. So we're currently discussing the idea of resuming the grab-and-go meal served at noon on Thursdays. It supplements our participants with another hot meal. It's not a home-delivered meal program, and we developed that agency-wide during COVID, and it was a wonderful way to stay in touch. So we're thinking of starting it in November, and we've got a little survey going around to see how people are feeling about that. So I hope that we will do it again and just give more service to our community. So please try to find some time to stop by and visit us. I know I sound like a broken record, but we'd love to have you. I think you would love what you see. So thank you. And as Kathleen said, if you have any questions, don't hesitate. Thanks.
I'll get in the hot seat. So are there any questions for us?
Anyone have anything they want to say? I will say it sounds like a great program, and I'm in my 60s, and I have thought in the past a couple of times I really should go down and check it out.
Please
so
do.
now I'm like, okay, I moved that up on my priority list and get myself down there.
And younger seniors are really a wonderful way, it's a wonderful opportunity to step in at a younger age, because then you get comfortable and it doesn't feel like you're walking into some strange place, you know. It's a wonderful place.
Aleth is my neighbor. Aleth, if I don't show up in the next couple of weeks, you can
Oh,
you're
in such trouble.
I was gonna say.
And one of the things that's really nice in all of our senior centers is we have an advisory council, and as Kathleen introduced Nancy and Aletha, so there's about 8 people on ours here, and we like to pull from different walks of life, and so in age groups and stuff, because everybody brings something different and interesting to the table. Thanks.
Any
Question?
Any questions or comments? Lots of smiles, though. Thank you for all that you do, and thank you all for coming out tonight.
Thank you for the support. We appreciate it.
We appreciate it. We make it light of it. Very nice to see you. My name's Paul. I'll see you there. Thank you.
All right, so let's see. Next on our list is
Bye.
Day Away program. Do we have anyone? What? Casa?
Casa.
All right, Casa.
The day away.
Well, thank you very much.
Thank you for coming. I have to say, you've been on our list, and I don't think in past years anyone from your organization has come, so.
Oh,
so happy
okay.
you're here.
Well, let me introduce myself. My name is Sue Chadwick. I do live in Bristol, very close to where Buzz lives, on Castle Lane. And I am a volunteer advocate with CASA. The development director was unable to come and said, hey, I live in Bristol, would I be happy to do that?
Thank you for coming.
Absolutely. So for those who may or may not know, that CASA of New Hampshire, CASA stands for Court Appointed Special Advocate. And we're the only organization in New Hampshire that recruits and trains volunteers to speak on the best interest of abused and neglected children that we're made aware of, usually from DCYF. And so CASA has an extremely good relationship with all the family courts within the state. They appreciate what we do and give us an enormous amount of respect. So I am a volunteer, and there are quite a few volunteers throughout the state, divided up by counties for sure. So CASA was founded in 1989 by Marty Sink, who is still our Chief Executive Officer. And in that time has represented over 12,000 victimized children in our state courts. A CASA volunteer is appointed by the court to advocate for an abused and neglected child's best interest. So my focus is just what is in the best interest of this child who has been probably taken from their parents, usually because of domestic violence, substance abuse, neglect, physical abuse, etc. And so an advocate such as myself becomes the eyes and ears of the court. I will create a court report for, in the beginning of any case, there's the adjudicatory hearing and then the dispositional hearing. And then after that, every 3 months, there's another hearing for that child as it goes through the court system. And I present my report to the courts, and it's given as much weight as that coming from DCYF. We work in conjunction, obviously, with DCYF, but we are not DCYF. Our focus is just the best interest of the children. So, we develop a relationship with the kids. Sometimes court cases can go on for many years, ideally within a 12-month period, but that's not necessarily typical. So the judge uses our information and gives it an awful lot of weight because DCYF social workers are dealing with multiple cases, 25 different cases of how many children in each case. CASA volunteers really only have 1 or 2 cases that might involve multiple children in each case. But usually only 1 or 2 cases that we can provide a much better advocacy and knowledge of the children and provide the court with better information. We're trained to help the child navigate the whole process. Sometimes it's very scary. They're in foster care or they're staying someplace else, or sometimes they are still with their parents but under supervision. What's most prominent anymore is substance abuse and the neglect of children due to that. Helping the kid navigate, or the children navigate what it's like being in a different home, and to find some stability with a loving home as quickly as possible. The goal is always reunification with the parents, that within that time period they'll abide by what the dispositional orders are from the court and improve that situation. And sometimes that happens and sometimes it doesn't, but children love their parents regardless. And so you're trying to navigate within that, but always keeping the safety and best interest of the children at the ultimate thing. So last fiscal year, CASA advocated, advocates spoke for 1,549 children. 9 of those children were from the town of Bristol, plus 6 others who may not be residing in Bristol, but go to the Alexandria or Bridgewater
school.
Oh, regional
Yeah,
school
So
district.
regional school district. The goal is always to serve 100% of abused and neglected children, but last year, kind of after sort of a post-COVID surge, it's been heartbreaking. The influx of cases has, CASA had to turn down representing more cases in the first quarter of this year, fiscal year 23, than it did during all of fiscal year 22. We used to advocate for maybe 85-90% of all the cases that were brought forward, and now it's much less, and I forget the exact number, but 65-70%, something like that. And that's heartbreaking when you read the story of these children and they're searching for a CASA who can volunteer for that. And they, everyone's full up pretty much. So, and the cases being presented right now seem to be the most severe cases of abuse and neglect that we've seen in the past few years. So last fiscal year, we could only accept 71% of the cases presented, which meant that there were 277 children who did not have a dedicated volunteer advocate for a case. And when that happens, when the judge is looking for someone to advocate and CASA cannot volunteer, there is a paid guardian ad litem that the state pays at a rate, I was surprised at this because I volunteer my time, but at a rate of $60 per hour plus travel. Over the past year, maybe that's not the whole year, but over the past years of CASA, the advocacy services have saved the state and the taxpayers more than this was just last year, more than $3.5 million last year. So I know I have 2 cases and with a total of 4 children, and it varies because if there's a court hearing, my time is more involved in that particular week, but usually 15 to 20 hours a month.
Okay.
Last year, I think CASA asked for $500. This year, they've increased that to $750.
I see that.
It's used for recruiting, training, supporting volunteer advocates such as myself. Estimated it costs approximately $2,000 to support one volunteer for a year. And funding from Bristol would allow CASA to continue its volunteer recruitment efforts that we may be able to serve more children in the state. And I think so far this year or last year, there were 89 new CASAs that were trained, and it's still just not enough.
Drop in the bucket.
It's become a drop in the bucket. So I will entertain any questions, and if there's anything I can't answer, I would advise you or refer you to Tara Bergeron, who I believe sent in the paperwork.
Okay.
What's the training involved? What kind of training is it?
So I trained during COVID, so it was all on Zoom. I think now they're doing both Zoom and in person because Zoom enabled them to do it throughout the state without a lot of stuff. It was 40 hours of training, and a lot of it was, certainly learning court reporting and that kind of thing. But most of it is just understanding what is happening, what kinds of family situations these children are being removed from. So we learned about domestic violence, we learned about substance abuse, we learned about the psychology of trauma being affected in the children. And there was a lot of sensitivity training, if you will, because many advocates, some advocates have come from traumatic situations, and some of us have not. And so how do you
empathize and understand and not judge. I think that's really the important thing. And that in, the goal of reunification and the parents being able to provide better for their children in terms of safety, etc., and how to, we're not asking anyone to become an A+ parent, but to improve their parenting so that the safety of their children is no longer at risk.
So you're acting like a social services person? You go in and you basically assess their home and assess the family? You don't do any of that?
No.
Okay.
DCYF does that.
DCYF, okay. Do you work in conjunction with them? You work with?
Sometimes, we certainly, their job or their focus are the parents, per se, and they're the ones who do an assessment of the home and things like that. We don't do, what we are, advocates are information gatherers, so that when we write a report to the judge, we can say that in what we've observed, the child now maybe in foster care, or living with a grandparent, a guardian, how the child is doing. If there's visitation with the parents, we observe and report how is that visitation going. Are the parents doing what they're supposed to do according to the dispositional orders or not? Because over the course of essentially 12 months, at the end of that 12 months, if the parents have gone through anger management and drug rehabilitation and blah, 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 and have shown themselves to understand parenting, and they're offered all sorts of services, we at the end could say this is now a safe place for these children, or we might say no, that's not going to, the reunification is not going to happen, and the safety and the welfare of the child would be better served via adoption.
So, and it's also completely volunteer, correct? And how do you get reimbursed for your travel and going, you don't get any of that? That comes out of?
No. I submit what my hours and mileage was so that they can put that in that report, statistically. There's no reimbursement.
There's no reimbursement.
There are support groups for different CASA advocates that opportunities maybe once a month to get together with other advocates and just talk about cases and learn more about different avenues of success. I know I've spent an awful lot of time with one case learning all about the school system that the child was in, becoming not friends with, but very well known within the school, and have a good relationship not only with the principal but with the guidance counselor and some other therapists there. I worked very hard to get and attended all the meetings to get that child an IEP in the school because they needed that. But so, it varies. I also have some babies who were born substance positive, and that's becoming extremely more common. And so the support groups that are offered, which is in a sense part of our training. I mean, it's kind of like ongoing professional development, if you will, and sharing that information with other advocates.
Yeah. Okay.
So the question I was going to ask is you said, I think for last fiscal year there were 6 children, and you will handle 1 or 2 cases. So do you handle? Are you the only volunteer in Bristol?
No.
Okay, so there is somebody else.
Actually, where I live has nothing to do with the cases that I get.
That was going to be my next question.
So when I signed on, which was almost 2 years ago, I said, well, I live equidistant between the Franklin Court, Plymouth Court, and Laconia Court. So I would accept cases from any of those courts.
Okay.
So it has nothing to do really with where I live. I mean, it's just because I have, and so one
Okay,
of,
so that when
yeah.
you sign up, they ask you which courts you're willing to participate in,
Right.
and then you can get an assignment from any child in any of those courts.
correct. So when, let's see how that goes. When DCYF they let CASA know that here's a case and we're taking, these children have to be removed, they're going to be put in foster care here or with, a family member there, and they present it to CASA and say, do you have a CASA who can take this case? And then from, CASA Central, which is, their headquarters.
Yeah.
Actually, there's a Laconia office, a Manchester office, a Plymouth, their
So there's
offices
regional
all
offices.
over. They'll sort of put out a broadcast email to their particular CASAs who would work out of that court, say, can anyone take this case?
Okay.
There are some CASA advocates who have maybe as many as 4 cases, but that's unusual because usually you can't really deal with more than 2 cases at a time and do the kind of work that CASAs do. Have the relationship with the children and the other contacts, whether with the school or whatever. So,
Okay.
did
That makes sense. No, that's what I was looking for.
Yeah.
Thank you. That was helpful.
Okay.
So when you say recruiting, how do you go about recruiting someone?
So the way that CASA recruits is, first of all, word of mouth.
Yeah.
The different advocates that they have, who do you know who might want to do this? And so there's that. There's radio ads, I think, on NPR currently. I think in the local paper, or at least in Newfound Lake Life and some of the other papers, there have been just, a couple of print ads. The website, there are no obligation online seminars, or seminar is too big, but just sort of an informational session that no obligation, you can sign up and say, is this for me? And becoming an advocate is not for everyone. There are some people who cannot do that. It's too triggering for them, or it's just not something, that they can do. But so it's kind of a broad way of advertising, I guess, marketing. And word of mouth is always the best. The other is, with the company I used to work for, my boss was on their board and I was the marketing director there. So I would go to all these different, as a sponsor to these different CASA events. And I'd get a t-shirt. They used to have a snowfest up at Loon. And I think I ended up with like 10 t-shirts that said CASA on it. And so I was working out in Ashland at a gym, and someone said, oh, CASA, what is that? And then it turned out that they did a little survey among new advocates. How did you hear about CASA? And the number of people who heard about it by seeing someone with a CASA t-shirt at a gym was
pretty high.
I was like, whoa. So, so sometimes stuff like that, it's more interpersonal and works.
Perfect.
No. So anyway, I thank you very much. Your
Well, thank you for
support
coming.
is more critical.
Yes.
Yeah.
Thank you for the work you do.
Yes.
Maybe.
Thank you very much.
Maybe you've seen the sign in front of, I don't know how, if you walk your dog past my house, but I do have a CASA.
I have to say, I've heard a
Sign.
radio ad, recruiting, we need more people, but I really didn't know most of these details. So this was very interesting and appreciate you coming to
Right,
share.
and I tell you, I was a little shocked, I go, what, they get $60 an hour? But they have bazillion cases, and so they don't have the time to develop a relationship with,
Right.
with a child. And at some of the annual events that CASA puts on, usually, a big fundraising in May, they have a CASA Cares thing, and it's a auction, and they raise a lot
You
of money.
advertise for that ahead of time, all that gets advertised ahead of time, so people know?
Oh, yeah.
Yeah. Good.
Yeah, there's, I think, like 400 attendees usually.
Oh, nice.
And, but they often have a former or a current CASA child, and there who, you end up crying, but saying that the only constant in my life for 5 years was my CASA, because everything kept changing. They lost their,
The system churns, and that was the one constant.
Yeah. Right.
Wow.
And the DCYF workers, they're not the same ones, and that maybe they're different foster homes, and then the only constant was the CASA, and so it's a good organization. So I hope that fund us. Thank you very much.
Thank you very much. Appreciate you coming.
Yeah.
So, I know there's nobody else here, but just for completeness, we haven't heard from Tri-County CAP, we haven't heard from Penny Baker Hospice and Home Health, we haven't heard from Katie, and we haven't heard from Bridge House. And obviously, we don't have anyone from any of those four.
And day away.
And day away, thank you.
The day away called today to confirm the time and said they'd be here at 7:15, so I'm not sure.
So I'm not sure why. At this point, we're not going to discuss the actual funding requests. We'll do that at a later meeting after we get the select board proposed budget and go department by department through that. So this was just a information gathering meeting, and I think it was reasonably successful.
So
Before I, go ahead.
before you, I will reach out to all of those, because the only issue we had was we couldn't access Wendy's computer today. Wendy's out of the office, and that was the only contact that they were working with. So I will reach out to them just to make sure that there were no issues, that they weren't hoping to attend via Zoom, because I didn't get any of those requests, and go and see if I can get them to come to another meeting, the ones that are missing.
I would think we would do the same thing we did last year. If any of the 5 organizations that submitted a request for funding support and did not come to the meeting tonight are willing to participate at a future meeting, we'll put them on the calendar on an agenda and ask them to come. Last year it was a little, so typically we handle this section of the budget fairly early in the process. And last year, because of our concern with the Visiting Nurse Association and things got busy, we kept postponing that. So it gave us more time. We handled them very late in the process last year. But normally, I think they're like the second meeting. So we really would have to either agree to postpone them to later in the process, or we need to get them in the next meeting or two so that they can provide information before we vote on the actual section of the budget. But I'll follow up with Chris. I think as chair, that's my job. I'll follow up with Christine and we'll figure out what's going on.
Because you have them scheduled for November, so your next meeting is the select
Our next
board,
meeting is to receive the select board proposed budget.
and then on November 14th, you were supposed to act on regional associations, health agencies, and outdoor.
Right, so
Outside
really it's only the meeting on the 24th, October 24th is really our, unless we rejigger the schedule, it's really that meeting on October 24th.
Yeah.
That will go over and.
That any of these 5 people, 5 organizations that were
Okay,
scheduled to meet with us tonight that didn't manage to meet with us would have another opportunity to come in and present their information.
And then we just need that information from the visiting nurses that he can
Correct,
provide.
but he was here, I am reasonably optimistic that he is gonna respond. He seems
Oh, no, I think he's
straightforward
It's
to
just,
me.
yeah, before we make that decision, I mean, just be, you know.
Yeah, I would expect we'll get something in the next week. I don't think he's gonna.
I'm not getting your select board materials out today.
I'm surprised Day Away wasn't here.
I'm surprised too, because Christina said that they actually called her office today to confirm time and that they said they would be here, so.
I've been right after him to be here, and I would speak for him, but I'm not capable of it.
No.
But
I'm just.
the age of the people that run Day Away is such that it's difficult to make plans.
We'll figure it out.
Can you see the screen? Well, here, there's a better one.
So I think we are done with the new business, which is meeting with the non-governmental organizations, the regional associations, outside agencies, and health agencies. So I'm going to move on in the agenda. So our next item is to review and approve the minutes of our last meeting, which was our previous meeting, which was August 15th, 2023. Did anyone who reviewed the minutes have any questions, comments, or concerns? Buzz, please go ahead.
And it's nickel and dime, but.
No, that's okay.
Under the interview candidate for open position, first paragraph, I actually represented and worked for insurance companies, not investment companies.
Okay,
The Travelers and MetLife.
gotcha.
Yeah,
So we'll change investment to insurance?
Yep.
Okay, any other comments or corrections?
I had something and I brought it up with Christine, but I think it best left alone.
Okay, then I'll leave it alone. I'll entertain a motion to approve as amended.
I'll make the motion that we approve the minutes as published.
As amended. Yes, as published and amended, because we're gonna include Buzz's correction.
I'll second that.
I hear that. Sue, do you want me to stall another minute so you can?
Yeah, I just haven't finished reading. I'm fast, but not that fast yet, hold on.
Okay,
I
so,
commend you for offering to do it, because it's important to the town that we have representation. And certainly someone of your caliber, I appreciate.
I've had them all fooled for a long time.
so
So
just for
while-
your minutes, you go ahead.
I was just gonna add while Sue's reading on the minutes.
Yep.
You will note that Shannon Wharton was the minute taker.
Yes, I did.
I was gonna bring that up, but please do.
Shannon has asked to come back, and we've accepted her coming back full graciously. So I said, please do these minutes for me.
Yeah.
So she is back. She won't be attending meetings in person, but she will set up your meetings, and she will do your meetings either via the live YouTube or via watch the recording after.
Oh, nice.
So she will take care of those things. So.
Yeah.
So I ran into Shannon at a public event and so I welcomed her back, and she said that since she had agreed to do it and Christina asked, she said when she went back and watched the review of our August 15th meeting when we talked about our administrative support and what a great job she'd done and how sorry we were she left, she said she was very touched and appreciative of all of our praise, and she was happy to come back. So that worked well.
Cool, okay.
All right, so we have a motion from Walter, seconded by Buzz. All in favor, rate aye. Aye.
Yeah.
Opposed? Abstain?
I'll abstain.
So we have 4 in favor and 1 abstain. The minutes are approved as amended. Next section is correspondence. I will inform everyone, I got a correspondence from Charlie. Charlie is taking a graduate program. His classes are Tuesday nights at 7 o'clock. So that's why he was here till 6:45 and then scooted out of the room. I think it was September. I know I wrote back to him and I said, well, we had a meeting in August, we don't have any meeting in September, so I think he's gonna have the same problem next meeting, but I don't think the course goes into November, so I should be careful, because I am talking off the top of my head, and I can't guarantee you I'm correct, but, you know, we all have to have priorities in our lives, and that's a conflict Charlie has, and is doing his best to work through it. I'm not sure, I haven't checked my email, but I did check my phone, I don't have any text. I got a note from a number of you, including Janet, saying she will be at the meeting tonight, so I don't know why she's not here with us right now, but I'm hoping it's not a medical emergency.
All I got was an email that she was coming, but I haven't seen anything else since.
And she did send another one after that, and sending her back was extremely painful, so.
Yeah.
Oh, I hadn't seen that, I
Yeah.
haven't seen that.
She didn't send it to all of us,
I
I don't
don't
think.
know, I don't even know, I didn't even check the same
Yeah.
for all of us, I don't know. I just saw it and I said, I hope you feel better. That's all I
Yeah,
can.
So,
I do have 2 communications with you.
okay, before let me finish, I just also, not so much correspondence, but we had the municipal authority training. I know a number of us signed up. I'm not sure, in fact, I'm pretty sure that not everyone that signed up went to the training. I'm not sure why that happened. I'm a little disappointed at that, because the town spent money on registration and we didn't all go.
I went, but I was.
But I know Sue went on the first training on the.
Did you go on one of the meetings?
I was scheduled to go to Littleton, but I ended up in Manchester.
I thought you were supposed to be in Littleton, and I looked
Yeah.
around the room and didn't see you, but you went the week before
For
Manchester.
some reason, they told me at the last minute to go to Manchester,
Oh.
and they didn't have my registration there, but the woman in charge got me in, and
I would think
got
that
all
as
the
long as you're
materials
paid, they
and-
don't care which one you go to, but.
No,
okay.
I just wanted to see Littleton, I haven't been to Littleton in
Well,
30 years, I just wanted to see it again.
all
It's
right.
funny, because I missed you then, because I was sitting there in the front, I was right in the front, I kept looking around to see if there's anybody else coming in, I knew, because I didn't know when anybody was going, but, yeah.
They rerouted me the 3 days before.
Wow,
Okay.
wow.
Oh, very
Yeah,
good.
Nice.
There was something else I was gonna say and now I forgot, so let me let Christina, what are you gonna say, Christina? 2 other correspondence?
Yes, so I have a thank you letter so these are from Voices Against Violence. So some of these came in
Oh,
like in June.
for fiscal year 23 funding?
Yeah, and you may not have I didn't bring them up at the last meeting, I don't believe, so.
No, I don't think you did.
It's funny, because this one's CASA. Thank you for your continued support from the town of Bristol. The recent $500 gift demonstrates your commitment to child victims of abuse and neglect and to CASA of New Hampshire. Thank you so much for helping us in our efforts to recruit, train, and supervise the hundreds of outstanding volunteers who advocate for child victims in our local and state courts each and every day. The children we serve desperately need a compassionate and consistent adult who will advocate for their safety and well-being. Without the voice of CASA volunteer, the trajectory of their lives could include residual trauma, mental illness, and substance misuse. We appreciate the opportunity to work in partnership with the town of Bristol. Thank you for sharing our vision of a safe and permanent home for every child in New Hampshire. So that's one. And Voices Against Violence. Thank you so much for your recent donation to Voices Against Violence. We are so grateful to have your support. From January to March, we served 355, which I kind of probably told you this part, 355 clients, provided 241 bed nights, and answered 174 calls to our hotline. Your donation helps us to continue to support victims and survivors and provide hope and safety to all members of our community. With gratitude, Voices Against Violence Board of Directors. And I know that some people wanted a book, and I just wanted to clarify that. They wanted the book and the addendum, and I have to place new orders, one, but I've ordered one for Sue, but I just wanted to make sure how many others when I place that order.
I would like one.
So again, for those of us who went to the training, they gave us an electronic copy, so you're saying they still have a printed copy?
They do have a printed copy, you can order them through
It's
the.
2022, right?
It's
With the addendum.
2022.
Yeah, 23 addendum.
And then you get the 23 addendum. I think we would have to just print that. There's not a lot to it, it's a few pages. But we can order the cover book for 2022.
I'm okay with the electronic copy I have.
I think, and I don't want to speak for her, but I want to say I think Janet did get one. but
I'm sorry?
I wanna say I think Janet did want one, but I'm not
Yeah,
100%. I think she said she did. Yeah.
Okay.
$30 at Staples, you can print it and have it bound.
So you took care of it already.
Really?
That's
Yeah.
more than they charge.
I wanted to have it to take to the
To the class.
to the class, so I printed all the rest of it up, but as long as I figured I'm gonna use this a lot, so it wasn't a big expense.
But you had to print it all out to get it to be bound, right?
Yeah, I just took my phone and
Well, you
printed
take,
it off.
you take the
Really?
file, I mean, if you put it on a flash drive, you can take it down to Staples and give them the flash drive and they'll print it.
I
for
know.
you.
I didn't have to
I
do
never
that,
think of
just
stuff like
email
that.
them.
I think you on the computer, I can't print all this out, man, it's gonna eat my ink.
And you can pick a better quality paper, which I did too, so that
Oh.
it'll stand up to repeated use.
So, I don't know if this is quite correspondence, but I don't wanna step on your toes, really. I just want to remind everyone, we talked about it in August, and it's in your schedule for the budget committee, but the select board now is working on their version of the budget. They've met for the past 2 Thursdays, they're meeting this Thursday in a working session, and then they're meeting next Thursday on the 19th, which is a regular select board meeting where they need to finalize what's going on. So we had said we canceled our meeting where we asked all the department heads to come in September and give us an overview, because we don't really get a lot out of that, and we're asking all those people to give up a night. So we said, instead, if you're really interested, you can go and sit in the select board meeting and listen to all that detail. So I've gone, but no, I just want to make sure that if anyone else is interested, you're certainly, I'm inviting them on behalf of the select board. I'm
Well, for
saying,
next-
but
you
if
mean
you're
for next
interested,
meeting, you mean?
if you're interested in the, what's that?
For the next meeting, you mean?
Yeah, so if you want to hear, I mean, we're gonna bring in all the department heads to our meetings and go over the budget in detail, but if you wanna hear kind of the overview and hear the questions the select board is asking, you have to give up a few hours of your time, but that is available. I just wanna make sure everyone is aware of that. That's really where I'm going with all of this.
And which meeting would that be for the next meeting? that you-
Thursday.
So today's the 10th, so Thursday the 12th,
Okay.
the select board is having a working session starting at 5 o'clock. I don't,
About 11, we'll get out.
I can't come out, so you
Let's wait.
I mean, Christina or potentially Les could tell you which departments are coming in. The first meeting was,
Just changed it again.
the
sorry.
first meeting was police and fire, I think. And the second meeting was welfare and, no, it was planning, police and fire. And the second meeting was welfare and
Town clerk tax.
town clerk, tax
collector,
collector, and beach.
And economic development committee and.
So I assume what, road, water, sewer is
So
this week?
I'm switching it up a little bit because I've had to with beach and town clerk board scheduled to later, so we bumped them earlier because they were already on the agenda. And we bumped library because they're gonna be on the October 19th.
Right.
So I'm trying to finalize the next one still, but it's highway, all the highway budgets and the solid waste transfer station, water and sewer budgets. And I believe we'll talk about regional associations, health agencies, outside agencies. And I'm right now struggling with the remainder, but I believe animal welfare, legal, insurance, and then principal long-term debt and interest long-term debt. Possibly general government buildings, but that may not be until the 19th, so.
I haven't been I was gonna say harassing, that's not a good word. I haven't been really asking Christina to keep me informed on the agenda because I've been planning to go to all 4 meetings. So I figure I go to all 4 meetings, I get all the sections, I don't really care what order they're done in. But if there's a specific department that you want to see, you can confirm with Christina whether they're gonna be this week on Thursday or next week on Thursday.
Well, there isn't, but so the 19th is the next one at 5
No.
o'clock. I can't make this, the 20th.
The 19th would be at 5 o'clock.
I can't
but-
make the 12th, no, that's what I mean, so I go the 19th.
But it's not a full work session, it's also a regular meeting.
Okay.
So I need to talk to the board this week because they have executive finance, personnel, administration, and library. And then they have to make their final decisions on
So-
what their budget's gonna be.
So can I, Christina, I'm asking you to send out a note to the budget committee, say by next Tuesday, to let everyone know what the agenda for the October 19th select board meeting is. When is the when is the non-public session gonna happen? When is the work session gonna happen? When is the public session gonna happen? So that we would show up at the time that's
I
most
will-
important to us.
Let me just tell you, I will, but the agenda is set by Tuesday.
So you think you might need more time to get that out?
Lately, it's been very hard to get everything out. So I will say Tuesday, that's my deadline normally, but tonight, obviously, I'm not sending their stuff out or the agenda because I'm here. And I've had a lot of other things on the plate today.
So the reason I'm asking is with the normal meeting last Tuesday, I contacted you and asked, because I assumed you guys were gonna do your non-public session at 5 the way you normally do, and she said, no, show up at 5, it's gonna be the working session. So,
Definitely work session.
and I didn't want all 6 of us calling you to ask when it's happening, which is why I'm asking you to send it out to everybody.
So I can send you the agenda tomorrow, that for the 12th, which is this Thursday, for those who can go to the 12th. And then I will try to make sure that the 19th is ready for next Tuesday as well, so.
But you'll send it out as soon as you have it available.
Yeah.
Good, that's what I need. So that's what I have for correspondence. Does anyone else have any correspondence that they want to mention or read into the record? I don't think so, good.
No, is Shannon on immediately? Is Shannon back immediately?
Yes.
She started last week.
Last week,
So she could catch up minutes for me.
Which is nice.
So
That'll
she-
catch you up a little
So
bit.
she is either watching
And
now
she
on the
helps set
computer,
up.
or she's gonna watch the recorded version of this meeting
Yeah.
and work up the minutes for this meeting.
Perfect.
And so we set up your folders. Tonight's a little different because you had a lot of different nonprofits in it, but we set up your folders in order of the agenda. And I number them to keep them together in order, like with those I do for the select board. So, and Shannon will take the USB and load the computers for me now. I'll probably still set up your materials for you in that fashion. And still send the invite, because Shannon may not have access to email right away, and I don't, we're trying to get that up fixed as well, so.
No, that was helpful.
And a laptop.
Okay. So our next agenda item is select board member comments. Les, anything you need to share with us or want to?
Just started to delve into the budget, so, and I am looking at a Zoom option for this Thursday, so, just happy to be back at budget.
Yeah, welcome back to the budget committee.
Yeah.
Staff comments? Christina, anything else that you want to bring up that we haven't touched on yet?
No, I can't think anymore.
I think that's it. Does anyone else have anything else they want to bring up?
No.
So I will entertain a motion to adjourn.
I'll second that.
Well, I want somebody to make the motion.
Oh, you're making I'll make
All
a
right.
motion to adjourn.
Make a motion to adjourn, seconded by Walter, all in favor? Aye. 5-0, it passes unanimously. So just to remind everyone, our next meeting is in 2 weeks, on Tuesday, October 24th. And our main order of business will be to receive the select board proposed budget. And I'm expecting Sean, somebody will come, I'm expecting it'll be Sean will come and give us that detail.
I know that technically we're off, but there is a new format, and I will do my best to make it as user-friendly as possible for you, because it is a new system.